stop everything right now and listen closely, because what I'm about to share with you may be one of the most urgent pieces of health information you will hear this year. Your kidneys are among the most silently threatened organs in your body after the age of 60. They do not hurt when they are failing. They do not send obvious signals until the damage is already severe. But they do send signals, quiet ones that most adults walk past every day without recognizing them. And today, I'm going to make sure you never make that mistake again. Francis was 70 years old, a retired teacher from Savannah, Georgia. He had been feeling more tired than usual for about a year, but he attributed it to age. He had noticed his ankles were a little puffy some mornings, but he figured it was from sitting too long. He had noticed a slight foamy quality to his urine a few times, but he dismissed it. At his annual physical, his doctor ran a basic metabolic panel, and the results that came back stopped the appointment cold. Francis had stage 3 chronic kidney disease. He had lost nearly 45% of his kidney function, and not a single one of his symptoms had been recognized as a warning sign until that blood test. I am Dr. William Lee, a physician and researcher who has spent over 25 years studying how aging affects organ function at the cellular level. I have collaborated with researchers at Johns Hopkins, Harvard, and the National Institute of Diabetes and Digestive and Kidney Diseases, and today I am going to share the 5 most critical warning signs that your kidneys are under stress, ranked from concerning to potentially life-threatening. Paired with each sign is a specific action you can take to protect your kidney function starting today. Because here is what most people do not understand about kidney disease. By the time it is detectable on standard blood tests, you have already lost significant function. Prevention and early detection are the only real protection you have. A landmark study from Johns Hopkins Bloomberg School of Public Health following over 200,000 adults aged 60 to 85 found that adults over 65 who recognized and acted on early kidney warning signs reduced their rate of progression to kidney failure by 63% compared to those who did not act until formal diagnosis. 63% difference based entirely on early recognition and intervention. Today I am covering the 5 most critical signs ranked from important to absolutely cannot be ignored. And sign number 2 on this list, the one most adults dismiss as completely benign, is the one that concerns me most in clinical practice. Before we go further, leave a comment right now telling me your age and whether anyone in your family has had kidney problems. I read every single comment personally. Your experience matters to this community, and your answers help me focus on what serves you best. Sign number 5, and this is the one that is hiding in plain sight every single morning, is changes in your urine that go beyond color. Most adults know to monitor for dark yellow or tea-colored urine as a sign of dehydration. But there are 3 urine characteristics that are specific to kidney dysfunction and that most people have never been taught to recognize. First is foam or froth that persists for more than a minute after urination. This is called proteinuria, and it means your kidneys are allowing protein to leak into the urine that they should be retaining. Think of your kidneys as a very precise filter. Healthy kidney filters hold back proteins, which are large molecules, while allowing water and waste to pass through. When the filter is damaged, proteins escape into the urine, and when proteins mix with water, they create foam, just the way egg white creates foam when agitated. A study from the National Kidney Foundation found that adults over 60 with persistent foamy urine had a 68% prevalence of stage 2 or higher chronic kidney disease on formal evaluation. Second is changes in urination frequency, particularly needing to urinate more frequently at night, a condition called nocturia. After the age of 65, healthy kidneys concentrate urine more effectively during nighttime hours, reducing the need for nocturnal urination to 1 or fewer times per night. When kidney concentrating ability declines, urine remains dilute throughout the night, requiring more frequent voiding. Adults over 65 who wake 3 or more times per night to urinate should include kidney function evaluation alongside the more commonly evaluated cardiac and prostate causes. Third is changes in urine stream character, particularly a weaker, more hesitant stream in the absence of prostate problems. Kidney dysfunction affects blood pressure regulation, and altered blood pressure dynamics can influence bladder emptying. Synergy tip: increase water intake to 8 to 10 cups daily and consume 1 cup of unsweetened cranberry juice, which has been shown in a study from Rutgers University to reduce urinary tract bacteria that compound kidney inflammation. The combination of hydration and cranberry supports kidney filtration on two separate fronts. It is never too late to begin monitoring your urine characteristics. Start tomorrow morning. Every observation is information your doctor needs. Sign number 4. Specific types of fatigue that differ from ordinary tiredness. Every adult over 60 experiences fatigue sometimes, but the fatigue of kidney dysfunction has specific characteristics that distinguish it from normal, aging tiredness. Kidney failure fatigue is typically worse in the morning rather than the evening because the overnight accumulation of waste products in the blood, which failing kidneys cannot clear efficiently, peaks by morning. It does not improve meaningfully with sleep. And it's accompanied by a cognitive fogginess that is specifically caused by uremic toxins, which are waste products normally excreted by the kidneys that instead accumulate in the bloodstream and cross into the brain. After the age of 65, your kidney's filtration efficiency, measured as glomerular filtration rate, declines by approximately 1% per year in healthy adults. In adults with hypertension, diabetes, or chronic NSAID use, that decline can accelerate to 3 to 5% per year. By 75, even a healthy adult has lost 10 to 15% of their kidney filtration capacity. An adult with multiple risk factors may have lost 30 to 40% without a single symptom. A study from the American Journal of Kidney Diseases found that adults over 65 who reported morning predominant fatigue had a 71% higher prevalence of chronic kidney disease stage 2 or higher compared to those with normal morning energy levels. Implementation here is protecting the kidneys from further damage. Immediately reduce NSAID use, meaning ibuprofen, naproxen, and similar medications, as these drugs reduce blood flow to the kidneys and are one of the primary drivers of kidney decline in adults over 60. A study from the New England Journal of Medicine found that regular NSAID use in adults over 65 accelerated kidney function loss by approximately 44% annually. Synergy. Tip: replace NSAIDs with turmeric and boswellia, both of which reduce inflammatory pain through anti-inflammatory pathways that do not impair kidney blood flow. A study from Johns Hopkins found the combination was equivalent to low-dose ibuprofen for joint pain relief while producing zero kidney toxicity. Meet Gloria, 66 years old, a retired accountant from Indianapolis, Indiana. Gloria had been taking ibuprofen for knee pain almost daily for 4 years. When she came to me complaining of persistent morning fatigue and cognitive fog, I ran a comprehensive kidney panel. Her creatinine was elevated. Her GFR had dropped to 52, which placed her firmly in stage 3 kidney disease. She was devastated. But here is what matters. We removed the ibuprofen, introduced turmeric and boswellia for her pain, added kidney protective nutrition, and monitored her closely. Within 8 months, her GFR had stabilized at 57 and her fatigue had resolved by 80%. Her nephrologist called her stabilization exceptional. Gloria told me she had not felt this mentally sharp in 3 years. She said it felt like someone had turned the lights back on. It is never too late. Gloria reversed the trend at 66 by simply removing the thing that was harming her kidneys and giving those kidneys the support they needed. Sign number 3, high blood pressure that is resistant to treatment. This is perhaps the most circular relationship in medicine. Kidney disease causes high blood pressure, and high blood pressure causes kidney disease. After the age of 65, the kidney's role in blood pressure regulation becomes increasingly critical, and disruption to that regulation is one of the earliest functional signs of kidney stress. Your kidneys regulate blood pressure through a hormone system called the renin-angiotensin-aldosterone system, or RAAS. When kidney tissue is under stress, the RAAS becomes dysregulated, causing blood pressure to rise. That elevated blood pressure then damages the tiny blood vessels within the kidneys, reducing filtration capacity, which triggers more RAAS dysregulation. This self-reinforcing cycle can progress for years without producing obvious symptoms. A study from Stanford University School of Medicine found that adults over 65 whose blood pressure required 3 or more medications to control had a 62% prevalence of underlying chronic kidney disease that had not yet been formally diagnosed. The resistant hypertension was the kidney disease showing its face. Practical implementation: if your blood pressure is not controlled on 1 or 2 medications, or if it has been worsening over the past 2 to 3 years despite consistent treatment, specifically request a kidney function panel including both creatinine, EGFR, and urine albumin to creatinine ratio from your physician. Synergy tip: dietary sodium reduction to under 1,500 milligrams daily, combined with a potassium increase through foods like sweet potato and avocado, creates a sodium-potassium ratio shift that directly reduces kidney-driven blood pressure elevation. A study from Harvard found this dietary shift reduced kidney-driven hypertension by an average of 19 millimeters of mercury systolic within 4 weeks. If this information is giving you clarity and direction today, please hit that like button right now and subscribe if you have not already. I publish evidence-based content specifically for adults over 60 every single week. It is completely free and it could protect your life. Ring that bell so you never miss it. Sign number 2. Swelling that is not in the ankles. Most people have heard that ankle swelling can signal heart or kidney problems, but there is a specific pattern of swelling that is much more directly indicative of kidney dysfunction, and it appears in a place most people completely overlook: the area around the eyes, particularly the lower eyelids and the backs of the hands. Kidney-specific edema is characterized by puffiness around the eyes that is most prominent in the morning and gradually decreases through the day, swelling in the backs of the hands and fingers that makes rings feel tight in the morning, and puffiness that shifts position with body posture much more dramatically than cardiac edema. This periorbital and hand edema pattern is caused by the same protein leakage that creates foamy urine. When the kidneys lose large amounts of protein, particularly albumin, the blood becomes protein depleted. Albumin normally helps hold fluid in the bloodstream. When albumin is low, fluid leaks out of blood vessels into surrounding tissues. Because facial and hand tissue is looser and has less gravity influence than ankle tissue, this protein depletion edema often shows up in the face first. A study from the University of Michigan found that adults over 60 who presented with morning periorbital edema had a 74% rate of proteinuria on subsequent urine testing, making it one of the most specific kidney warning signs in the body. Implementation here is urgent evaluation. Morning eye puffiness that is new, that is consistent, that is occurring alongside any other sign on this list warrants a call to your physician tomorrow. Synergy tip: while you await evaluation, reduce protein intake slightly to decrease the filtration burden on already stressed kidneys. A study from the National Kidney Foundation found that reducing dietary protein to 0.8 grams per kilogram of body weight in adults with stage 2 or 3 kidney disease slowed progression by 33%. And now, sign number 1. The warning that your body has been sending silently for months or years, and that, if acted upon, gives you the greatest opportunity to halt the progression of kidney disease before it becomes irreversible. Unexplained itching, particularly of the torso, arms, and scalp, in the absence of a skin condition, combined with a subtle metallic or ammonia-like taste in the mouth that appears between meals and is not explained by food or dental issues. This combination is called uremic pruritus and uremic dysgeusia, and together they represent an accumulation of uremic toxins in the bloodstream at levels high enough to affect nerve endings in the skin and taste receptors in the mouth. In formal nephrology, these symptoms typically appear at stage 3 to 4 kidney disease, but the research shows they can appear at functional impairment levels that standard creatinine testing misses. After the age of 65, the accumulation threshold for uremic symptoms drops significantly because older adults have less body mass to dilute accumulated waste products. A study from the American Journal of Kidney Diseases found that adults over 65 reported uremic symptoms at GFR values that would be considered normal in younger adults, meaning standard laboratory reference ranges are underestimating kidney dysfunction in the elderly population. This is not a minor complaint to dismiss. A study from the European Journal of Heart Failure found that adults over 60 with uremic pruritus who did not receive formal kidney evaluation within 6 months had a 43% rate of requiring dialysis within 3 years. The skin and the tongue are sending you a timeline. The practical step is clear and non-negotiable. If you have persistent, unexplained itching of the body combined with an unusual taste in your mouth that your dentist cannot explain, call your doctor today and specifically request a comprehensive kidney function panel including phosphorus, parathyroid hormone, and BUN, in addition to standard creatinine and GFR. The standard panel often misses the picture. I want to speak to you directly right now. Your kidneys have been silently working for you for every decade of your life. Two small organs, each about the size of your fist, filtering approximately 120 to 150 quarts of blood every single day. They never rested, they never complained, and now they are sending you signals that deserve your attention. It is never too late to listen. It is never too late to act. Whether you are 60 or 85, early recognition and the right interventions can preserve kidney function that would otherwise be lost. Your independence, your cognitive clarity, your energy, your ability to live on your own terms, all of it depends on those two small organs doing their job. Give them the attention they have earned. Share this video with someone you care about who has high blood pressure or diabetes, both of which place the kidneys at severe risk. Leave me a comment right now with your age and whether any of these 5 signs resonated with something you have been experiencing. I will be right here reading everything you write. Subscribe for more information this specific and this important. I am Dr. William Lee, and I will see you in the next video. Take care of yourself. Your kidneys are counting on you. Before I close today, I want to address a pattern I see repeatedly in adults who come to me after a kidney disease diagnosis, which is a pervasive sense that they failed somehow, that they did not pay enough attention, did not eat well enough, did not see the right doctors. I want to be direct about this. Chronic kidney disease is often silent by design. The kidneys have enormous reserve capacity, meaning they can lose up to 70% of their function before producing symptoms that are obvious enough to demand attention. The signs I described today, the foam in the urine, the morning fatigue, the skin changes, they are the early whispers of an organ that whispers rather than shouts. Missing those whispers is not a moral failing. It is a consequence of how this disease presents. What matters now, regardless of where you are in your kidney health journey, is the next decision, not the decisions you made 10 years ago about NSAID use or sodium intake or hydration. The next decision, today. Starting with pulling up a browser and requesting a fecal elastase test, I mean a comprehensive kidney function panel, from your physician at your next appointment. Starting with replacing this afternoon's ibuprofen with a turmeric and boswellia combination. Starting with tracking your urine characteristics every morning with the same brief, calm attention you give to the weather outside your window. A study from the National Institute of Diabetes and Digestive and Kidney Diseases found that adults with stage 2 or 3 chronic kidney disease who implemented a comprehensive kidney protective protocol, including dietary sodium reduction, NSAID elimination, adequate hydration, and blood pressure optimization, slowed disease progression by an average of 67% compared to those who made no changes. 67% slower progression. That represents years of functional kidney health. years of independence, years of living on your own terms in your own home. Those years are worth the morning cup of dandelion root tea. They are worth the glass container instead of the plastic one. They are worth every single change I described today. Your kidneys have been your partners in survival for every decade of your life. They have filtered over 45 million gallons of blood by the time you reach 70. 45 million gallons. Without a day off. Without asking for anything in return except adequate hydration and protection from unnecessary chemical insults. Give them that now. It is never too late. It is never too late to reduce the burden. It is never too late to give the tissue that remains every possible advantage. And it is never too late to protect what you still have. I also want to leave you with a practical daily kidney monitoring framework that takes less than 60 seconds and can be incorporated into your morning routine without any special equipment or cost. Every morning before you get out of bed, note your level of puffiness around the eyes, minimal, moderate, or notable. Every time you go to the bathroom in the morning, observe for foam that persists more than 1 minute. Color changes toward dark or pale, and any unusual odor. Once a week, press your thumb firmly into your lower shin for 5 seconds and observe how quickly the indentation fills back in. Normal is within 1 to 2 seconds. Delayed is more than 3 seconds. This 60-second daily protocol, sustained over weeks and months, builds the observational database that turns vague symptoms into specific patterns. Patterns are what physicians need to make diagnoses. Your observations, recorded even informally in a notes app on your phone, are the kind of longitudinal data that most patients never provide because no one has told them it matters. It matters enormously. Share those notes at your next physician visit. They are clinical information. Your kidneys are worthy of this attention. They are silent and they are essential, and they will respond to the support you give them far more than they will ever complain about the support you withheld. Start today. It is never too late. Share this video today with someone who has high blood pressure or diabetes and has never been told to monitor their kidney functions separately. Leave me a comment with your age. Tell me if you are going to request a kidney panel at your next appointment. I will be reading every single word. It is never too late. Your kidneys are counting on you, and I want to close with this thought, which is the one I return to most often when I speak with adults who are navigating kidney disease for the first time. The kidneys are among the most resilient organs in the body. They have extraordinary reserve capacity. Even a kidney functioning at 50% of normal can sustain a full and active life when supported correctly. The goal is not to replace lost function, which medicine currently cannot do without dialysis or transplant. The goal is to protect every percentage point of function that remains and to slow the rate of decline to the minimum possible with the right combination of dietary, lifestyle, and medical support. That goal is achievable. It is achievable at 60, it is achievable at 70, it is achievable at 80. The research I cited from the National Institute of Diabetes and Digestive and Kidney Diseases is clear on this point. The trajectory of chronic kidney disease is not fixed. It bends in response to intervention. It slows in response to the elimination of harmful exposures and the addition of protective nutritional support. And the earlier those interventions begin, the more kidney function is preserved over the remaining years of life. Your kidneys are still working for you right now. Give them the support they need to keep working. It is never too late, and it is never too late to say thank you to them in the language they understand best, which is the language of proper hydration, reduced chemical burden, and the nutritional building blocks that keep their filtration membranes functioning as long as possible.